ready? You ready? Ready. 1, 2, 3. Airways intact.
SIH spent 5 years working with the Illinois Department of Public Health to meet the strict qualifications for a Level 2 trauma center. With that designation, the facility must provide essential services 24 hours a day.
Pelvis is stable.
And have specialized services readily available like orthopedic surgery, neurosurgery, anesthesiology, emergency medicine, and radiology.
A trauma patient hits about every department in the organization.
Vice President Administrator Al Taylor says the first hour after a traumatic injury, also called the golden hour of medicine, is when patients have the highest likelihood of survival with prompt medical treatment.
The whole southern part of the state does not have a trauma center. These patients that have trauma injuries used to have to fly or travel an hour and a half, 2 hours away in order to get care.
Trauma surgeon Dr. Edward Smith-Singaras says reducing the travel time to medical care will save lives.
40 minutes, it's already more than 2/3 of the golden hour. So if the EMS crew is not at the site of the accident within the first 10 minutes, the patient will be late. The first golden hour of outcome will be missed.
Memorial Hospital, Carbondale, Jackson County, 5.101, a courtesy call.
Carbondale, go ahead.
Jackson County Ambulance Director Keaton Schaefer says the communication between first responders and the hospital is crucial during that first hour.
We are essentially the eyes and ears of the physicians at the hospital. So the more information that we can provide to them, the earlier we can provide it to them, gives them a better opportunity to be prepared whenever we arrive so that there's no delay in care.
Arch Air Medical Services Supervisor Chris Whitlock says before or now, trauma patients were flown to the closest trauma center in Evansville or St. Louis. Having a trauma center in southern Illinois will reduce flight time significantly.
We're maybe a 13-minute flight from anywhere in this county back to here. The farthest reaches of southern Illinois, we can be here 20 to 25 minutes. So that is going to be a massive impact for people to be able to get to that surgical care that they need much, much faster within that golden hour.
Our goal was to prove that we can take care of multiple victims at the same time, and that our operating room, our trauma staff is in hand to manage multiple victims.
Dr. Smith-Singaras says prior to Memorial going live as a trauma center, they ran a practice drill to make sure they were ready.
To a two-car motor vehicle accident with multiple patients and possible entrapment. We've contacted Air Medical. We'll give you further when we get to the scene.
He has a penetrating wound to the left chest. It's been dressed. Only obvious injuries that we can find at this time.
During the drill, actors portrayed victims of a major car crash, arriving at Memorial needing critical care.
Is the Belmont ready for transport?
Take that lift.
Taylor volunteered to be a patient during the drill and appreciated seeing how well the staff works together from the patient's perspective.
I think the drill went great. I was in the helicopter as with the drill helping the team, and it's an amazing group. It's like a symphony. You have the entire team from the folks at Arch with the helicopter. Everybody's doing their part. You just watch them. One person's doing one thing, another's doing another, and then we roll into the emergency room. Everybody's got a role. Everybody knows what they're doing.
Dr. Smith-Singaras says having drills like this
Line count. 1, 2, 3.
helps them fine-tune their procedure to provide the best care possible.
We all are aiming for a more perfect care of our trauma patients. And the only way that we're going to achieve that is by examining the process in which they are intaked and they receive the care. This process has multiple joints. Drills are supposed to stress these joints so we can find things to improve, opportunities for improvement.
For WSIU, I'm Benji Jeffords.